Now, mandibular nerve. Nowadays, very much important for your exam, sir. In mandibular nerve, what you do is, first of all, on the screen you're able to see, it will be having like two things, sir. One is the motor as well as the sensory part. Mandibular nerve, mixed one. It is having two components. One is the sensory component, another one is the motor component. And both of them are combining together. They are passing through which foramen? Foramen ovale. We know the mnemonic male. So we know that the mandibular nerve is going to pass through which foramen? Foramen ovale. Fine. Now first you'll be able to find the trunk of the mandibular nerve. This is the trunk of the mandibular nerve here, sir. And now the trunk will actually divide into two division. One is anterior division and posterior division. About the anterior and posterior division, I'll tell you later on. Now please remember first about the trunk, my dear friend. In the trunk, you have to remember 4 points. Point number one. We know that mandibular nerve 5-3 is supplying to all the muscles of mastication. And out of the 4 muscles of mastication, trunk is supplying to one of the muscle of mastication. Remember, medial pterygoid muscle. Point number one. Remaining all the muscles, rest all muscles of mastication will be supplied by anterior division. Rest all muscles will be supplied by anterior division, but they have already asked in the exam, trunk will be supplying to only one muscle of mastication, that is medial pterygoid. Now, that same nerve which is supplying to medial pterygoid muscle, it is also giving a branch supplying to two tensors. How you are going to remember? Two tensor. Tensor veli palatini, tensor tympani. Then third point, yes, the same nerve, the trunk is giving one more branch, that is nervus spinosus. What is its name here? What is this nerve here, my dear friend? This is nothing but nervus spinosus. And I told you very clearly, nervus spinosus is going to pass through the foramen spinosum. The foramen spinosum along with middle meningeal artery, Yadoga. So that is the third point to remember. And finally, the fourth point to remember is the trunk of the mandibular nerve is passing through a ganglion, that is otic ganglion. So on this slide, there are like 4 MCQs possible here. 4 MCQs यहाँ पर important है इस slide पर, ठीक है ना? So the trunk of the mandibular nerve is supplying only one muscle of mastication, medial pterygoid. Number 2, it is supplying to two tensor, tensor veli palatini, tensor tympani. Number 3, it is giving nervus spinosus. And number 4, it is passing through a ganglion, otic ganglion. Now about the anterior division, you just have to remember it is supplying to the rest all muscles of mastication. Lateral pterygoid, masseter, temporalis, उसको supply करता है. But posterior division is very much important, sir. Why? Because questions are coming from here in your exam. Posterior division is the one which is giving 3 branches, and we remember that as Ali branches. A stands for auriculotemporal nerve, L stands for lingual nerve, I stands for inferior alveolar nerve,